further divisions of the basal ganglia. So the second division is the amygdaloid nucleus, which is situated in the temporal lobe, close to the uncus. The amygdaloid nucleus is a part of the limbic system, so it is connected with the response of the body to environmental changes, and in the sense of fear, it can change the heart rate, blood pressure, skin color, and the rate of respiration. Now let's talk about substantia nigra and subthalamic nuclei. So substantia nigra belongs to the midbrain, and the subthalamic nuclei belong to the diencephalon. They are functionally related to the activities of the basal nuclei. The neurons of substantia nigra are dopaminergic and inhibitory, and they have connections to the corpus striatum. The neurons of the subthalamic nuclei are glutaminergic and excitatory, and they have connections with the globus pallidus and the substantia nigra. Now let's talk about the claustrum. It is a thin sheet of gray matter, and it is separated from the lateral surface of the lentiform nucleus with the help of external capsule. Lateral to this is the insula, which is a subcortical white matter. The function is unknown. Now let's talk about the connections of the corpus striatum and the globus pallidus. The caudate nucleus and the putamen will form the main sites for receiving the inputs. They act as afferents. The globus pallidus will form the major site from which the output will leave the basal nuclei. They have no direct input from or output towards the spinal cord. Now let's talk about the corpus striatum, afferent fibers. So basically projections to the corpus striatum will include the corticostriate, thalamostriate, nigrostriatal, and the brainstem striatal fibers. So now let's talk about the corticostriate fibers. So they're going to come from the cerebral cortex, and they're going to send axons towards the caudate nucleus and the putamen. And they're going to project to a specific part of this complex. And glutamate is the neurotransmitter of the corticostriate fibers. CTNB was a mnemonic, so the next is the thalamostriate. Thalamostriate comes from the thalamus intralaminar nuclei, and then it is going to lead towards the caudate and the putamen. And nigrostriatal fibers are going to come from the substantia nigra, and they're going to send their axons towards the caudate nucleus and the putamen, and they're going to be dopaminergic and inhibitory. And brainstem striatal fibers, they're going to come from the brainstem, and they're going to end into the caudate nucleus and the putamen, and they're going to liberate serotonin for inhibitory function. Now let's talk about the corpus striatum efferents. The efferents are going to be SP and SN. So they're going to be striatopallidal or striatonigral. Striatopallidal efferents are going to lead from the caudate nucleus and the putamen towards the globus pallidus, and they're going to have GABA as a neurotransmitter. Now let's talk about the striatonigral fibers. They're going to pass from the caudate nucleus and the putamen towards the substantia nigra, and they're going to have GABA or acetylcholine as neurotransmitters, which are both inhibitory. Now let's talk about the afferent fibers of the globus pallidus. So afferent fibers are going to be SP, which are striatopallidal, and they are going to lead from the caudate and the putamen towards the globus pallidus, and they have GABA as a neurotransmitter as discussed before. Now let's talk about the efferent fibers of the globus pallidus. So they are going to be AFPP, ansa lenticularis, fasciculus lenticularis, pallidotegmental fibers, and pallidosubthalamic fibers. So all of these are the pallidofugal fibers. They are complicated and they can be divided as such that the ansa lenticularis is going to pass towards the thalamic nuclei. The fasciculus lenticularis is going to pass towards the subthalamus. Pallidotegmental fibers are going to pass towards the tegmentum of the midbrain, and the pallidosubthalamic fibers are going to pass towards the subthalamic nuclei.